everyone, welcome to today's webinar. For those of you who haven't heard of the School for Public Health Research, we're a partnership of 9 different members in England, trying to improve inclusive, equitable access to public health research and improve public health practice. And as part of our school, we've got an equality, diversity, and inclusion programme, and we have small awards for that where researchers can explore different pilot projects. So one of those is Ameeta's project, looking at EDI across the different NIHR infrastructure. So today Ameeta's going to be telling us a little bit more about that. So I'll hand over to you, Ameeta, to share your slides, and we'll make a start.
Brilliant, thank you, Amy. So I'm going to share my slides and I'll just check everyone is able to see them. Does that look okay to everyone? Yeah, fantastic. Okay, so thank you so much for joining. So as Amy said, I'm going to be talking for about 25 minutes. It may feel like longer, but I will try and stick to my time. And because really what I'd like to do in this session is kind of hear your views on the findings. Some of you took part in the study, which we're really grateful for. And yeah, it's just really lovely to be able to speak to you all about it and share the findings with you. So I'm presenting on behalf of a wider group. So I'm part of the School for Public Health Research in the team that's based in Birmingham, Warwick and Keele. And so got some of my team members on the names on the slide here. And so just to give you a sense of where this all originated, as you all know, there's lots and lots of equality, diversity and inclusion activities and lots of variation in approach. This study took place between September 2024 and February 2025, and it was developed as part of the SPHR Small Award Programme for EDI, but also with the NIHR Research Inclusion Team and the Infrastructures Team. It is a collaborative study, so with the kind of one NIHR ethos, and it was cross-institutional, so all the way across the country. And as far as what our aims were, these were to describe the EDI structures in NIHR-funded infrastructures, and also to explore the barriers and facilitators that people experience when they were embedding equality, diversity, inclusion principles and operationalizing their EDI strategies. So what we did was we had a survey that was online, and then we subjected that data from those surveys to descriptive analysis to understand the different kind of patterns within those data. And we also did semi-structured interviews, and that was with people as part of infrastructures who had EDI or research inclusion as part of their remit. And we combine those data, and what we have now is kind of an overview of what works, what doesn't work, depending on the research entity, and a series of recommendations. So what we actually have is what we ended up having was 99 individuals from NIHR infrastructures were invited for the survey and the interview. A total of 20 people took part in interviews and 49 took part in the survey. And you can see here that we have a few caveats. So we're aiming to talk about kind of NIHR infrastructures, but you can see from the infrastructures, they are fairly narrow. So we have applied research collaborations, the ARCs, biomedical research centers, the BRCs, the clinical research facilities, the health tech research centers, the NIHR 3 schools, which is for primary care, social care, and public health, the patient safety research collaborations, and also the research support service. And so, as you know, that does not cover all of the NIHR entities, but we had to kind of set some kind of boundaries, and so we did choose to do it this way. And so, as you can see, we had a range of people took part in the survey and also in the interview, but not everyone was able to take part because at the time there were different entities coming up for rebidding, and so we have to kind of be clear about the limitations of these data. They only are kind of generalizable to the people who took part and the entities that took part. But what happened was that we found that EDI practice was really variable, and it appeared to vary by infrastructure. And we only kind of explored this descriptively, and we kind of came up with 16 themes. Some of those themes have both qualitative and quantitative data, so our interview data and our survey data. Some of them are qualitative only, so they're just qualitative kind of themes. And then we have 11 sets of recommendations. And so the way that I've structured this presentation is that I'm going through each of the 11 recommendations, the themes that were behind them, I'm going to show you some of the overall kind of the reasoning for why those recommendations came into play, and I'm going to show you some of the qualitative data. And I've split them. Some of them are split up by infrastructure type. So I'm hoping that there's something there for everyone. But really, what this is that anyone who's spoken to me about this report that came from this project, it's a very big report, and that's because I was really keen to not to kind of have it warts and all. Everything that was shared in those interviews, in those surveys, I wanted to be able to include. And so it's really, really long, but this is a taster. So do bear with me. So as I said, there were 16 themes, and so I'm not going to go into these in detail. And I'm really happy to share these slides afterwards if that's helpful for people. But this is kind of that overview. They cover a range of different things, and some of them map directly onto the recommendations. So one of the recommendations related to people who are the staffing in EDI and research inclusion. So what we found from both the qualitative and the quantitative work was that those roles were very often unclear. When EDI or research inclusion roles were added to someone's job, it was often without consultation, and the workload was not adjusted to account for those extra responsibilities. And but what people did say was that they distinguish between the kind of the operational delivery of research inclusion and the strategic oversight of those activities. So there are these two different levels that people were talking about. And that support was really, really important so people could actually deliver on their EDI objectives. And there was a lot of variation and a lack of clarity about how the staffing for research inclusion was resourced. And so this has got really, really small text. So I don't expect you to be able to read it, but I just wanted to show you who it was who had responsibility from, this is from the survey data, who it was who had responsibility for research inclusion or EDI within the infrastructures that the individual was reporting from. And you can see that the majority were PPI, so patient and public involvement leads, who also had this additional responsibility for EDI. And then there was kind of a 35% approximately had a dedicated one. But we can also see that we have academic capacity development had that crossover with EDI, or there was some other role, or in very few cases, there was nobody who was responsible. So as far as EDI planning and strategy development, so a lot of respondents shared how they had limited time or notice to be able to generate their EDI strategies or research inclusion strategies. And as a result, they were not really able to seek consultation during the development of their strategies. And but what they did say that really helped was allowing for periods of review within their strategy, often after a few years, which allowed them to re-strategize and reflect. And they also found that having flexibility within their strategies enabled them to be responsive when they needed to be, so they could take advantage of new opportunities that would be beneficial to their infrastructure and was not currently covered in their objectives. So that flexibility was really important. And so this is where I've broken it down by infrastructure type. And so again, I don't know how people feel about seeing data. It can sometimes feel really overwhelming, but just to kind of talk you through, so we have the different infrastructure types along the bottom, and they're grouped that way. And so we have the applied research collaborations, the BRC, the CRFs, the health tech research centers, and so on. But I just wanted to flag that so the applied research collaborations, at the time that they were reporting, 50% of the respondents said that they had a strategy. And if you compare that to our 3 school participants, our patient safety and the health tech and the BRC, they all had them. So I guess the degree of formality that was kind of assigned to the strategy was variable across different infrastructure types. And then they also they also reported on having kind of clear deliverables, having smart objectives, and where we have this kind of grayish blue, it's where participants said that their strategy was in development. So that basically everyone was at very different kind of stages of formality around their EDI. So as far as the structures that enabled them to deliver their EDI stuff, a lot of participants described having EDI champions, and very often though these roles were undefined or unclear. But what did help was making sure that their activities were embedded within their governance structures. and in their infrastructure activities that promoted accountability. And what these things did was they kind of distributed the responsibility for research inclusion rather than it being tied to a single person. So it meant that like there was a lead or there was someone who had overall ownership, but it was spread about and it wasn't tied to that one person. Also, participants said how small award projects funded by infrastructures enabled exploration of new topics or kind of pre-prioritized areas. So these were really useful. Again, so I've kind of grouped it by the infrastructure types. And what we've done here is kind of we asked in the survey what kinds of EDI things did the different infrastructures have. And so you can see there's like a purpley browny kind of color. And that's that they had a dedicated research inclusion or EDI committee. And the kind of lighter blue is that they had research inclusion champions. So it was more likely that people had committees, but they had these different entities as well. And there were some cases where people were not sure, but you can see that some of these things reflect how they interfaced with the NHS, for example, because we have those that have kind of cross NHS EDI committees. That's the red color. And so yeah, okay. Um, so for PPIE, so colleagues will be really familiar with working with PPIE colleagues. And so what people kind of reported was that very often this could be quite siloed. And so research inclusion and PPIE colleagues were unaware of each other's activities. And when this came down to contacting and doing their work with community organizations or doing kind of that outreach work, they would often be targeting the same groups multiply, and which kind of would also result in those groups being a bit overwhelmed. And so it was really important for the roles and responsibilities for people working in research inclusion and PPI to have really carefully delineated responsibilities, and for the terminology that's used to also be really clear. Otherwise, there's a lot of potential for duplication between those colleagues. And one challenge that was really clearly indicated was that there was a lack of clarity when doing their reporting about what would fall under research inclusion and what would fall under PPIE. And so from this, I think it's really it's so again broken down by infrastructure type. We have the participants who've reported having those research inclusion roles. And I just wanted to kind of flag, so it's not very powerful at the moment because you can see though, this cream color was that the PPIE lead was when people indicated that their PPIE lead had responsibility for EDI. So you can see how those things can become conflated because it's the same people doing the same stuff. And so if you're it'll be really important to keep that in mind when trying to delineate the different kind of roles and responsibilities. And that was particularly likely to be the case in applied research collaborations and in health tech research centres. In the BRCs, they were more likely to report that there was a dedicated EDI lead. So that's something to bear in mind. So the collection of diversity data, we'll all be really familiar with the kind of onus on us to collect diversity data. And what people said was that there was a lack of guidance for how to go about doing this. But what did help was working with methodologists, so people who do research and kind of design research to configure what are our success metrics, and using different forms of data. So using qualitative, so interview or focus group discussion data along with survey data or quantitative data to be able to assess those metrics. What participants were really clear about was being able to standardize data collection would be helpful because it would enable the pooling of data. So if you're collecting data from one area and another area, you can combine them, and together that data becomes a lot more useful. There was also kind of participants indicated the need for more guidance on how to prioritize data collection. So if we're like, who are we talking about? What are we talking about? And what's the most important? And then where it's not possible to collect original data, so going out and creating your own data collection systems, people were not sure about what the steer was in terms of using the best available data. And also people were very, very mindful about participant burden when thinking about those diversity data collection processes. So I think this is you'll see a much busier data slide coming up, but So this is the percentage of participating infrastructures reporting barriers to diversity data collection from an organizational perspective. So as we know, all of our infrastructures are embedded within other organizations. And so these were the things that people were kind of considering. So again, the colors aren't great on this, but the cream color is kind of where people were reporting data protection considerations. So those were a barrier. The lighter blue is a lack of clarity about what to do with the data once it's collected. That's a really, really important point because if you're thinking about the rationale and like when you're talking to people about collecting their data, why are we doing this? They're not very sure. So that's really important to bear in mind. The kind of grayish, bluish, greenish kind of color, that is where people indicated that there was a lack of resource to manage the data collected. And so you can see that that's been cited quite often. And it was only in a couple of cases from CRF colleagues where there was a noted lack of guidance from NIHR. But you can see that there are loads of different factors that contribute to making it kind of difficult to collect these data. So then thinking about the implementation, so the implementation of research inclusion. So what people kind of said was that there was obviously, I mean, it seems obvious, but it's really good to be able to evidence it, that buy-in from senior leadership was incredibly important. But what was important to note was that we need to be really realistic about our objectives and our expectations because where we set impossible or unfeasible objectives, colleagues reported being really demotivated. And that is an important consideration. And there were cases where colleagues did report how the EDI structures and mechanisms that they built as part of their research inclusion kind of activities were actually used in practice to report and evidence cases of discriminatory, like a discriminatory practice. So that kind of is that's really, really important because that's the whole point of this, isn't it? Is that we're trying to minimize these sorts of this going on. So that is great. But what was also important to note is that some participants described that even where they had these mechanisms to report and evidence cases of discrimination, they were often not able to respond appropriately because they didn't have that degree of responsibility or it was not within their remit to respond. So that is an important kind of point to make. So this is a graph to describe how participating infrastructures reported what they did to enable people. So as part of their implementation of EDI and research inclusion, what is it that they did? What activities were there? So the things that they offered to their different members in their infrastructure. So you can see that, so we've again broken it down across different infrastructure types. And so just to show you the kind of that light blue was that training was really commonly offered in each of the infrastructures, slightly different for the Health Tech Research Centre, whereas so the kind of peachy colour was, the beigey colour is the offering of public outreach opportunities, and that was offered throughout all of the different infrastructures too. What's kind of what we can note is that there are the black bar here is the use of audits, and so audits were more likely to happen were more commonly reported in the three schools, the research support service, and in the applied research collaboration, but not in the others. So yeah, everyone was using different activities to bring people in and do things with EDI and research inclusion. So as far as resources, participants noted that limited resources restricted their EDI and research inclusion activities. There were varied resources facilitated the delivery of those objectives. So people drew on a lot of different resources. We're talking about availability of different colleagues to work with. We're talking about actual funds. It was really, really varied. But this included being able to access colleagues working in communications. That was really, really helpful to many of the people who were taking part. And also being able to work with those who are involved in research conduct and delivery. So yeah, working kind of in a cross-cutting way was found to be really helpful. So again, a very busy slide, but I just wanted to show you, so you can see just from on face value, the range of colors here shows that So each of these colors represents a different form of EDI resource. And so when we say resource, we're talking really, really broadly. But so this kind of this coral kind of color that's on the far left of each of the different ones is where team members have EDI within their job description. So it's a formal kind of responsibility that they hold, and it is a form of resource as a result of that. So you can see that there is kind of like a burgundy kind of color, which is a shared resource between hubs. This was only kind of cited in the biomedical research centers, and that's about it. And then we have again, just to show the kind of variation, the kind of you can see the coral color, and then we have this beige color, which is that the person responsible for EDI had dedicated time formally accounted for within their role. And this was quite variable, but you can see that that was more commonly reported by our patient safety research collaboration colleagues. So yeah. As far as working across infrastructure, so taking even this example of us being here today, working cross-infrastructurally. So one thing that participants kind of noted was that being unable to access those kind of infrastructure network arrangements so being unable to access infrastructure arrangements so they were unable to access the infrastructure arrangements that could have facilitated the delivery of their objectives. So that was a barrier that people experienced. Competition between infrastructures was also a barrier to effective co-working and across and between infrastructures. And I think that's probably something we can all maybe somewhat relate to. And then participants, especially those working across several infrastructures with multiple potentially overlapping strategies. So it may be that there's one strategy in like the HRC, and then there's a strategy in the BRC, and then it would become confusing, but also it wasn't clear how much those individual strategies would need to differ by each infrastructure. So that was just something that people had said. Another very busy slide, I apologize. But this was the percentage of infrastructures reporting their enablers of EDI and research inclusion. And the reason I have this here is because so that kind of coral color it's the one about the senior leadership. That buy-in was really important. But I wanted to flag that that within this, there was being able to get informal advice from peers working across other NIHR infrastructures. And that's this kind of black color. And you can see that this black color is there in all of except for the 3 schools, but in pretty much all of the research, in all the different research infrastructures. So it is important to be able to work with other infrastructures and also from those within your own infrastructure too. So that's the beige color, creamy beige. So working with institutions and organizations. So this is where I get kind of tied up with my own kind of jargon, but this is essentially working with entities that are not strictly NIHR. And so this could be with universities, it could be with NHS. And so what people reported was experiencing difficulty in being able to participate in EDI roles, especially if they were within infrastructures, if they were based within the NHS or in a university. There was also this note that the NHS's own commitment to the kind of research inclusion that's kind of those activities in NIHR infrastructures is really important because the NHS is often an employer of several infrastructure staff and thus kind of best placed to uphold the EDI kind of principles. And so this kind of co-location is really important. Also, people kind of shared how they had difficulty accessing key people and groups and committees working in other institutions. So, for example, in an NHS entity or in the university. So there was just these barriers that they experience outside of the NIHR infrastructures. Another busy slide, but again, I just wanted to show you that across these different infrastructures, this was the kind of different barriers of to EDI. And again, I wanted to kind of flag here because we have it broken down by kind of the degree of access to people working in non-NIHR infrastructures, including higher education institutions and NHS trusts. That's this kind of grayish blue. And you can see that that kind of varies quite a lot based on infrastructure. So, for example, that wasn't so important for the applied research collaboration colleagues, but it was pretty important for people working in health tech research centres. And I think it's just that's maybe because of the potential proximity or like the remit of those infrastructures. So yeah, it's just something to kind of bear in mind. Um, yeah. So this is where it's kind of the catch-all, which is like there's working with NIH infrastructures, those institutions, and other organizations. So this was kind of working with anyone who works within EDI. And so again, there was this problem of kind of accessing these cross-working groups because like very often people reported how like there were these key groups that they really wanted to break into because it now allowed them this access to all these different people, all these different resources, like just being able to know what was happening elsewhere. So that was reported as being difficult, but also for infrastructures that worked with entities outside of NIHR funding streams, for example, those working in the commercial sectors who had different priorities to NIHR and them having to maybe sometimes compromise on their EDI obligations because they have this need to generate their own income and having to interface with commercial entities. So that was really important. And I just wanted to kind of show you, this is, again, very busy, but participants reported different ways of expanding their research inclusion activities. And so part of this was, if we kind of look across, there are people were describing about working in alignment with NIHR objectives, but also being able to work cross-organizationally. So this one on the far left, 80% of people kind of reported that. So yeah. As far as then, so this, remembering that this study was happening before research inclusion came in as a condition for research funding, that was in November of last year, and this study finished in the summer of last year. But what they were saying was that further guidance on the conditions would be really, really important because the interpretation of research inclusion from the infrastructure's own point of view may differ from that of the NIHR's own ones. And there was a lot of interest in opportunities to contribute to how that condition for funding would evolve. And I just wanted to kind of share this slide. Again, I think I've shot myself in the foot with the color of these bars, but this nice green color is the no. And so of the people who were reporting from the participating infrastructures wanting to have more support to do EDI, a lot of them said yes, they would like some more support. Some of them said no, very few, but you can see it's really kind of fairly broadly positive if you wanted to have more support. But then thinking about kind of where we are right now, we have this extremely detailed report. It was shared with our NIHR colleagues. It was reviewed by all the participants that took part in the qualitative work and also more broadly. And we are planning to kind of keep on disseminating. The challenge is, as I said, we have this incredibly long report, and I'm hoping that after kind of sitting through my talking at you for the last like 25 minutes, you will want to, this is just the tip of the iceberg in terms of the stuff that's in that report. And we're also working towards an academic publication. And so I will stop sharing now and I will give thanks to our funders and what I was hoping to do with the next kind of little bit. If you're comfortable and would like to turn on your cameras, I'd really welcome you to. But yeah, if anyone has any questions, any thoughts, I'd really welcome them. Yes. I don't know, Amy, what do you think?
Yeah, we've got a couple of questions in the Q&A, so we can start with those, and then if anyone wants to ask a question, then please raise your hand or yeah, put it in the chat. So the first one is, where can we get guidance on diversity data collection processes at the point of trainees applying for roles?
Oh, so as far as with that, I probably am not the best person to ask, but I would imagine that a lot of that, or as much as possible, that information would be available from the NIHR website, but I understand also that because there's a diversity data strategy that the NIHR has. And so yeah, but that is not something that I can confidently answer. There may be others on this call, probably very likely, that are more positioned to answer that. I'm sorry.
And then the next one we've got, what are the next steps and actions following the findings of this report for central NIHR and the different infrastructures?
So I can't speak for the different infrastructures or for central NIHR, but this is a piece of work that we did do in partnership with colleagues in the NIHR. And we shared we kind of worked really closely during the running of the project. We were independent, and so that wasn't something that they didn't shape it in that way. But as far as being able to rapidly kind of feedback some of the findings, that's what we were doing. And so, and I mean, I think some of our NIHR colleagues are on this call as well. So there has been really good engagement. And really the challenge is for us to make, again, I can't, it's like a thesis. It's such a long report. And so the challenge is for me to be able to break it down and share it with people before it becomes outdated as well. Things change so fast. So yeah.
Thank you. Any other questions from anyone? There's nothing in the chat or the Q&A. Yeah, Anastasia, have you got your hand up?
Yeah, so just more of on the point of data collection. Or I was working in with an experience that university versus any NHS, they have different depth of data collected, and especially for ethnicity, NHS will have the whole spectrum of different ethnicities, different mixed ethnicities, while university only has three white, other than white, and prefer not to say. So there's any, I mean, I don't know how can you tackle this? Or maybe there will be a general guidance for everyone to collect data differently so that we can compare directly university versus the NHS staff and recruitment and everything.
Mm-hmm. I think that kind of speaks to one of the points in our findings about kind of having consistent data collection kind of models, or like to standardize that. So I know that the NIHR has shared kind of a range of different items that can be collected as part of diversity data collection, but also colleagues working in the NHS and in different parts of our research ecosystem are somewhat restricted by the systems that are already in place. And so there's this question about kind of using existing data collection systems versus kind of generating our own and having something that goes across everything. And so really what is needed kind of is consensus from all of the different kind of actors within those different pockets of the ecosystem to be able to decide on that. Because ultimately, if you're working within the NHS, for example, and you're thinking about, it also depends on what stakeholders it is that you're trying to collect those data from. Is it from staff? Is it from participants? Is it from, because they will also be subject to their own kinds of information governance kinds of restrictions as well. I mean, we have got a huge number of people on the call who may be like chomping at the bit to answer these questions also. So I invite you to please do contradict me if I'm answering incorrectly, but I think that need for the standardized data set is really important, but we also need to recognize the systems that restrict different entities from doing that as well and changing their categories.
Thank you. We've got a question from Addy as well. Addy, if you want to unmute.
Hear me?
Mm-hmm.
Yeah.
The first thing to say is well done, Ameeta. As a collaborator on this study, you've done a huge job, both in the work itself, but also in the presentation. I think I've seen one or two comments also saying well done. So I know no matter how often you've done these things, you often worry, have you pitched it right? You've done a great job, so well done. And I'm going to be mean and ask you a couple of questions, but because I'm also a collaborator, if you find any of those questions too difficult, then just say, Addy, what do you think? And then I'll answer it. So the first one is, and you've alluded to this, there is this issue of whether we should still be thinking about EDI or equity or research inclusion. And it's interesting because NIHR has actually gone from EDI to research inclusion. More claps. Well done, Ameeta. And I guess having been immersed in this work, I'm just interested in your sense. Do you think if we moved away from EDI, it would the benefits would be outweighed by the fact that particular ethnicity will potentially um, be lost as a focus, or do you see it as a strength moving away from EDI? So that's the first question. And whilst you take a few minutes to to reflect on that, the second question is really very, very mean, and should really be answered by NIHR. So NIHR, as most of us will know, have opted to have a single host uh, institution strategy for PPIE. However, they decided not to do that for research inclusion. And again, I guess my sense is, do you think actually having more joined up strategy and that they should actually do what PPIE has done? I'll stop there because you've done such a great job, and I don't want to. I don't want you to start getting worried. And if there's any questions you can't answer, happy to support you. Thank you, but great job, Ameeta. So proud of you.
Oh, thank you so much. I'm going to have a go at answering both of those. I think, and this is very much my own view. It's not that of anyone who funds me. But I would say that as far as the terminology that we use, I I think that as far as things like EDI, equality, diversity, and inclusion, very often the reason that we change our terminology is to make it kind of more palatable to the people that we are trying, our broader audience. And so we have to continually adapt. We have to continually kind of think, well, if EDI becomes a dirty word, then we need to keep on being able to do our work, and we might just have to call it something else. So we have to be pragmatic about the labels we use. And I think what's really important is making sure that we don't, with the renaming of things and with the kind of pragmatic kind of activity of like relabeling, this happens. It's not just EDI, it happens to, it's any kind of fields that faces any kind of adversity. They rebrand. We just need to make sure that at the core of it, we're still kind of embedding, like integrating those principles of equality, equity, diversity, and inclusion. And we're not losing sight of the groups that really need this, because centrally the whole point, like in my presentation, I talked about how with the building of these mechanisms within infrastructures, people actually use them. People experience discrimination and they can use them. That's really meaningful. And so at the heart of, and like we have more inclusive, representative research participation. We have kind of more sustainable research careers for people experiencing social inequity. That is at the very core of it. And it really doesn't matter what it's called, as long as at the core, that is what we're doing. And so, yeah, if we have to rebrand, that's okay. That's fine, as long as we keep on doing that work. As far as the cross kind of strategy, I think I've been really fortunate to be part of lots of strategy development in different infrastructures locally and nationally. And we can spend a lot of time developing strategy. I know colleagues kind of locally have spent a lot of time on that cross-institutional PPIE strategy. And I also know how day-to-day kind of work takes over. And we can spend a lot of time developing a strategy that very often maybe the challenge is then operationalizing it. And so again, it's like, we do need to be working kind of with our collaboratively and with our neighbors, and we need to be bringing people in. Is a strategy the way to do it? I think we don't, maybe it is, maybe it isn't. Do we call it a strategy? Do we not? I think having fora to be able to share information and to be able to work together is really important. And if a strategy is the way to do it, fine. If it isn't, also fine. But what's more important about all of this is like, well, what's the means of getting the resource we need and the buy-in that we need to be able to do this work? If a strategy helps, I think it does help to have like something there as a touchstone. But who is it that's accountable to that strategy? And does it become too lofty to not meaningfully pull someone in and like maintain some accountability. I think that that's kind of the most important thing. And like one size fits all is tricky, but yeah, they also need to formalize stuff. So I understand that as well. But yeah.
So you answered questions better than I could have done. So well done. So I'm going to push you not with my own question, but a question I've just seen, which says, "This is it's like you're going for the distinction mark here." Having it says EDI has legal implications, and that if you lose the term EDI, then you may be losing those legal protections as well. And I will stop there so others can ask you questions.
Thank you. Well, that is a really, really important point because it kind of relates to the Equality Duty, the Equalities Act. And yeah, I think as far as, and this is where I kind of get out of territory that I don't really know much about, because as far as who holds those duties, I know that kind of public entities, they hold those duties. And if, again, if EDI is the way to meaningfully realize it, and I think this is what Millie has kind of said is really important. Kind of it speaks to my earlier answer about kind of being really interrogating what's at the heart of these activities. Is it kind of, are we driven by these kind of duties? Are we driven by this kind of need to redress things and address unfairness and making sure our work is representative? That's what's important. I think also because, I mean, we've seen with our kind of colleagues across the Atlantic Ocean where it says, where there's any kind of study that talks about EDI, they just did control delete. So we need to also recognize that if we're going to try and keep working in it, we're in a really ever-changing political environment in the UK as well. And so we do need to think about it. Our colleagues working in local authorities, they also will be experiencing kind of the fear around how likely are they going to be control alt deleted because of their EDI stuff or like relating to their EDI activity. So we have to have that balance. We don't want to kind of relabel to the point of not being meaningful, but we need to also recognize the environment can sometimes be a bit hostile. So yeah.
Thanks, Ameeta. We've got a question from Rebecca and then a couple on the chat. So Rebecca, if you want to go ahead with your question.
Thank you very much, Amy, and thank you so much, Ameeta. That was really rich data and really, really interesting to read, and I will spend a lot more time reflecting on the findings. So what I was interested in is you mentioned that having kind of too many objectives or unachievable objectives could become demotivating. And I wondered if you might be able to speak a little bit more about some of the aspects that are demotivating and how to kind of counter that, because when you're kind of supporting an EDI through an infrastructure contract, I kind of feel like there's a wave of kind of initial excitement and enthusiasm at the start, but then it's how you sustain that, especially when some of the objectives are difficult to achieve or where there's competing pressures, or there's a risk it starts to feel like a bit of a tick box just to do what you have to do for the annual reporting, and it can become a bit less meaningful. So yeah, any insights from your qualitative work, perhaps particularly, or your reflections more generally would be super.
Mm-hmm. And so from the qualitative work where people talked about that demotivation, they also talked about, so when they kind of developed their strategy, they submitted to the NIHR, and sometimes they received really, I was only able to kind of skim over some of the findings that we have, but there was a whole thing about the kind of process of like to and fro between the infrastructure and the NIHR and getting really meaningful feedback. There were cases where people said that, look, like the NIHR said that you've bitten off too much, that's not going to be feasible. And so they kind of were asked to like kind of really think about what was realistic, and that was very helpful. I think we need to recognize that a lot of the time the EDI responsibilities are put on people who maybe don't have a lot of time to do it. We don't have a lot of resource to do it. And so the likelihood of there to be demotivation is really high because they are just not set up to be able to do that work. And so also being careful about where the deliverables and those action plans kind of fit into the reporting, because if you're tied to doing it, but you don't have the resource to do it, that becomes really, really difficult. And so I think this careful matching of kind of deliverable to action owner to resource is really, really key. And then also, because we know that when infrastructures are funded, they may not all be funded in the way that was kind of designed in the bid. And there might be cuts, which can sometimes affect kind of research inclusion activities. And so then being able to kind of have that agility to change what your objectives are. I mentioned about kind of making sure, building in that there are periods of review, because and also being, I mean, and this is where, because I suppose this is maybe a slightly outdated experience because people were kind of thinking back to when they initially kind of were part of their bids, and things may have changed as far as how the NIHR kind of sees that. But if you have got that flexibility to change, to pivot within a 5-year period, a lot can change and things can become more or less important. Things can suddenly become really, really important, and you will have to change. Otherwise, you're delivering an outdated strategy, which can also be really demotivating. So I guess it's just that careful matching at the start of what's kind of feasible, and then having that ability to adapt and be dynamic if possible.
Yeah, that's really helpful. Thank you.
We've got some questions on the chat as well. So Millie's asked, the conflation of PPIE and EDI has been problematic on many different levels. What would your recommendation be on how to tackle that?
Oh, that's such a good question, because I'm sure that colleagues on the call are really familiar with these things just being kind of put together. And I think what is really helpful is to just recognize the breadth of research inclusion in EDI, because it covers so many different aspects of research and the research community. And whereas like PPIE is a very particular kind of activity, and there's a really specific need for it, and it does EDI will overlap with PPIE. As far as how to kind of make sure the two don't get conflated, I think it's that, just like making sure that, because people do put them together. Even today, I got an email about PPI, and it's like, I don't like, I that's not really what I do. There are colleagues who do it far better than me, and so it happens. So it's like when that happens, we need to kind of speak to it and say, not the same. That's really not the same. And from the positions that we're in, kind of making sure we continually say that. So I'm part of another research entity that's not NIHR funded, but I was working with my PPIE colleagues, and we were presenting to the broader team. And the first thing we said is that we are different, and this is how, and this is what you can expect from me, this is what you can expect from them. And so just continually talking about it, and also kind of making sure that PPI and research inclusion colleagues work together, so that we can just see where there are overlaps and where there may be kind of duplication, and also so that we can kind of back each other and make sure that our lines aren't blurred too much, or like kind of inappropriately. But yeah, not an easy one, because it's rife, isn't it? It's like it happens all the time. Yeah.
Thank you. We've got a question handed from Ashfaq. If you want to go ahead and ask your question, thank you.
Hi, Ameeta. Such a wonderful presentation. I really like the data, and it's very rich, both qualitatively and quantitatively. I mean, for EDI and research inclusion, you mentioned about different activities, including like trainings and public outreach opportunities and others kind of things. In your own experiences or your knowledge, which activities you think are more effective, and or any other activities you think which could be added? Thank you.
You know what? So I love an audit. I think an audit's really, really useful, just because it allows kind of an internal review of things. So I mean, I can speak to the audit that I did when I was part of the Applied Research Collaboration in West Midlands, and we just did an audit of all of the kind of projects on the research portfolio. And in our strategy, we kind of we try to do that regularly. But what that means is being able to establish something of a baseline. I think that's, and because of that, we were able to kind of systematically understand what was the research portfolio like. We were able to go to the different kind of research leads and describe, like, people love hearing about their own work, and they like to be able to see what did they do well in, what did they not do well in, did they do as well as that team? And so coming with I really like that kind of data-driven approach, but it also allows you to kind of establish a baseline and kind of have something to work from. So that's really, I think that's a really good way of doing it. I think like the community engagement is so important because it's this kind of multi-pronged kind of potential, like there is so many different ways it can be helpful, because you get that public engagement. You also get the opportunity to take your research team and give like public proof them, make them good. And like that's a really, really valuable skill, especially for kind of early career researchers, postgraduate researchers, and like thinking about that pipeline and kind of making sure that this is not something that we're having to prescriptively do, but it's just something that's part and parcel of the work that we're doing. So yeah, I mean, there's a place for everything, and also recognizing that different infrastructures have different purposes, different functions. And so what will be really important in one, maybe not the case for another. So yeah, no one size fits all, but I don't think audits get enough good credit. They are great, and we should all, because you get to pull together program managers, you get to pull together everyone. And so, and you can really get to know the projects. I remember pretty much all of the protocols that were in our audit, and I didn't know anything about them before. So especially when you're coming as research inclusion or EDI, you need to be able to familiarize yourself with the research portfolio that you're working with. And that's just very, very powerful. So audits are great.
Thank you. We've got another couple of questions in the chat. So are you aware about whether they've incorporated any of these findings into how they structure their offer to the infrastructures applying for funding?
So
Just how it's been used so far.
So I mean, I know that we shared it, and I know that around the same time I mean, some of you might have been involved. I was involved in the NIHR did their own work to kind of, I think, some kind of focus groups and kind of these workshops to talk about the conditions for funding. And so this happened, our project happened just before, and so we were maybe able to feed into that. I actually can't say definitively how much it has shaped things or how much it's been used, but I do know that we shared it, and I do know that we got kind of positive feedback. But yeah, I couldn't say anything more, I'm afraid.
And then we've got a nice one to follow on with is, what are next steps and actions following your findings for sort of central NIHR and the different infrastructures? What would you like to kind of see happen next?
Well, I mean, like, so this is a time capsule of a project. So it was happening. I mean, so much has changed since the last time, since we did this. I mean, I talked about the ARCs, but the ARCs have all changed really dramatically. Our BRC colleagues are like thinking about rebidding. We have lots and lots changing, plus we keep talking about the broader like research ecosystem and things like that. So lots is changing. So what I would hope is like to be able to really push this out as much as I can while it's still relevant. And then like, I mean, talk about an audit, talk about a baseline, like kind of continuing this sort of work so that we can keep it central and visible and maintain like an evidence base around it. And so yeah, because I mean, without it, we're just not going to have as high quality research as we could. And that's really the core part of it. So yeah, just more of this sort of activity, I think, and more transparency about what it then does. Probably we're getting out of time now.
Yeah, just the last couple of minutes now. We haven't got any more questions. So unless people have got any more questions, I don't think I've missed any hands up. Just to say a big, big thank you, Ameeta. That was really interesting. We will share this webinar recording on the school's YouTube channel in the next few days. So I've popped the link for that in the chat. And if anyone does have any questions sort of after today, then please email sphrcomms@newcastle.ac.uk, and I can relay those to Ameeta. So yeah, thank you very much, everyone. I hope you enjoyed the webinar, and yeah, we'll see how things go over the next sort of few weeks and months. Thanks very much.
Thank you. Thanks so much, everyone. Thank you, Amy.